So hello everyone, welcome to this Global Network webinar. My name is Alexander Loschke and I will be moderating this webinar today together with my colleagues Sean Lovell and Panya Yu. Today we have with us Enrique Delamónica from UNICEF and Oliver Fiala from Save the Children, who will talk about the concepts, data challenges and measurement challenges of pro-poor public social spending. So SDG indicator 1B1, pro-poor public social spending, measures the share of government spending that directly benefits the monetary poor in education, health, and direct transfers. Measuring, analyzing, and reporting on this indicator helps countries access the evidence needed to properly design, implement, and finance policies to end poverty and achieve the other SDGs. So this webinar presents in more detail the methodology behind the measurement and the data that is required. It will highlight examples and best practices and will point to existing tools and support available to produce estimates for this indicator. Let me now briefly introduce our two speakers. So we have with us Enrique. Enrique has advanced degrees in economics and political science from Columbia University and the New School in New York City. He has worked for UNICEF for almost 30 years, concentrating on policies to improve the lives of children and their families, including poverty reduction, social protection, financing social services, equity, and impact for macroeconomic trends on children. Oliver is a senior research advisor at Save the Children UK and leads the research and data hub there. His work covers a wide range of thematic areas, including child poverty, public finance, child health, education, and child protection. He also oversees the development of the Child Atlas, which is Save the Children's data visualization platform. Oliver holds a PhD in economics from the Technical University of Dresden in Germany. So before we start and before I hand over, let me just say that we will first have the presentation and then we will have a Q&A session at the end. Feel free to write comments and questions into the meeting chat at any time. During the Q&A session, we encourage you to ask your question yourself in order to create a more interactive atmosphere. And as always, this Global Network webinar is being recorded and will be made available on the Global Network of Data Officers and Statisticians at yammer.com/UNstats. And we invite you to continue the discussions on the Global Network after the webinar. So now I will hand over to Oliver, who will be the first person to speak today. Thanks.
Great, thanks, Alexander, for the introduction. And yeah, I'm happy to kick us off, and then I'm handing over to Enrique in a bit. So as Alexander said already really nicely at the scene, we wanted to introduce a bit further SDG indicator 1B1, talk a little bit about the motivation behind it, like why we think this is really important to measure. We are quickly touching on the methodology, which sits basically behind that indicator, which is the benefit incidence analysis, a methodology which is around for a really long time. But I will give a quick introduction with a couple of examples just to familiarize all of us and also to highlight a little bit what kind of data is required from a more methodological point of view. And then I'm handing over to Enrique, who talks us through the SDG indicator specifically, its concepts and definition, and yeah, the data we have so far, both for 1B1, but also more broadly to measure benefit incidence across countries. So on the motivation, I think for us, that indicator became, or the idea to measure the indicator is obviously particularly important from a leave no one behind lens. So as you're all probably all aware of, the 2030 agenda has particularly that pledge to leave no one behind. But despite that fact, we do find children who are denied their rights in health or education or protection to be, not surprisingly, unfortunately, often poorer. They live in more disadvantaged areas. They're discriminated against based on their gender, disability, or ethnicity. And at Save the Children, we did a few years ago, like this analysis you can see here on the screen, that, for example, we found across like 87 countries that children from the poorest 20% of households account for a third of all child death. Right, so a smaller proportion of the population counts for a disproportionate part of the burden in different outcomes. And what we also notice, and that's the message of the next slide, is this kind of double jeopardy. So we're not only seeing children with the highest risk being more concentrated in, for example, poorer areas, but we also find those often having the lowest access to services. So again, doing the same analysis, we compared, for example, in this case, it was child mortality and stunting, and we compared that with access to healthcare, and we did find exactly that picture you see here on the screen, where you have the burden, those are the two lines at the top, concentrated more specifically on poorer households, but the access to services more concentrated on richer households. So again, that's not a big surprise, and it's not something which is unique to individual countries. I think that's a picture we see in richer and poorer countries alike, but it kind of reminds us that it's important, if we want to address the pledge to leave no one behind, not only to look at outcomes and inequality in outcomes, which is very central and where much more work is needed, but also to focus more on inequalities in inputs and access to services, and one step further, to focus on how services are being financed and if those finance mechanisms benefit particularly those children who are having the greatest needs and those children who are living in poverty. And that's the idea behind benefit incidence analysis, and with one step further of our SDG indicator 1B1. So let me talk a couple of minutes about the benefit incidence analysis. So as you will see later when Enrique introduces the indicator is basically just one particular measure coming out of a benefit incidence analysis. So we thought it would be helpful to give a little bit of background and a short example, talking quickly through that methodology. So that's not something which is really new. It's around for a really long time. The origins were in the 1930s and 40s with applications in the UK and the US. There are a couple of books which were published in the 70s doing similar bits. And in the 90s, UNDP and UNICEF, for example, carried out benefit incidence analysis in health or education for quite a few countries in the global south. So it's not something which came up yesterday or which is a completely new machine learning tool. It is a really well-known methodology, which has been refined, obviously, over the years. And when we later speak about the applications and about the data that exists, we will highlight a couple of approaches which are around at the moment and which have done a lot of methodological work to strengthen that, and which are particularly applicable, for example, in low and middle income countries. But overall, the methodology is really well known. So let me give you a quick introduction into the more detailed methodology. And we thought we use an example just to make it a bit more tangible. And there are two different sources of information which we always need for that. One are budget information and more generally administrative data. And that is important for the first step, where we want to estimate the value of services to individuals. Often we do that out of necessity, and because it's really hard to capture often individual benefits from services. So often we focus on the unit costs. How much does it cost to provide those services? So in our example, in the next couple of slides, we focus on education. Very similar approaches would happen in health, would happen in social transfers, but for the purpose of this example, we focus on education. So imagine you have budget information for a particular year, where you have a total spend in education, which, for example, is in our example $5,200, but it could be like $5 billion, whatever the budget is. That obviously we can break down that overall budget into primary and secondary education budget. and we can also break it down by tertiary and by pre-primary. But again, for our example, we keep it simple here and have only those 2 levels of education. So that information comes from budgets, like from budget data on the different sectoral spending. Now we need to combine that information with administrative data on, in this case, students enrolled in school. So for example, we will find that in primary education, 9 children, or imagine 9 million children, are enrolled in primary school and 5 children are enrolled in secondary school. So having the information about the total budget and the students enrolled in school, we are then able to calculate unit costs. That's what you see in the 3rd column. So we can calculate, for example, that per student enrolled in school, there is a budget of like $300 in primary school, and per secondary school pupil, there is a budget of like $500. So those are the unit costs, and those will therefore, in our analysis, be the benefits which are being assessed in a way. So that's the first step. For the first step, we do require budget information and require some more administrative data, also on the levels of spending, depending on different administrative divisions and federal structures in different countries. So those information are coming from administrative sources or specifically budget sources. So that's the first source of information, and that's the first step. In our example, in our first example, we keep the unit cost constant. So therefore, all children, they are the same unit costs, which is certainly an approximation that we can take and which is often being taken, but also very likely they will depend. They will depend on the location of schools, for example, the type of schools, and other kind of factors. And we will later look at a really quick example where we try to vary the unit cost because that has really important implications. But in the first step, let's just assume those are constant for all children within primary school, for example, and for all children within secondary school. So that's, as I said, budget and administrative data. The second step will require household survey information. So that's the second source of data, is a household survey, which can be different kind of surveys, and we will speak about the requirements in a second. But in that second step, we need to identify the utilization of services. So which children specifically in our example are going to school and which are not going to school. So you see here those smaller heads, which are our younger children in our surveys. So those are primary school age. And then you see those larger icons. Those are our children in secondary school age. And you see there are 10 children in each group, again, to keep it simple. So in using the survey information, we now can identify which of those children is basically attending school. So in that step, as it says on the at the top, we want to identify utilization of services. So for example, we can see in primary school, there are 9 out of 10 children are attending primary school. So 1 child is not attending primary school. So it's our out of school rate in a way. And that child is identified in red. And you see on the right-hand side in secondary, for secondary school, we have a bit more positive, a more negative attendance rate. So we have more children being out of school. In this case, we have 5 children out of school and 5 children attending school. And again, the attendance rate of 50%. So that's the understanding of which children are in school and which are not. So now we have identified which individual children uses the services. Now that we know who are using the services, in the next step, we need to rank those beneficiaries. And that's a really important step for benefit incidence analysis, that we not only need to know who is utilizing services, but we need to know what we need to group them basically, or we need to rank them in a way. And often this is done by a different kind of welfare measures. In most instances, this is being done by household income or a wealth measure, but it could be other kind of welfare measures. But that requires therefore surveys which do measure that dimension which we want to use. So in our case, let's assume we use household income. We have this continuum there. On the further to the right of the arrow are households which are richer. Further to the left are households which are poorer. And you can imagine we are drawing somewhere a poverty line. So for national poverty line or any other kind of poverty line you want to look at. And now we are basically, as the step says, we are ranking those beneficiaries by their welfare measures. So in the survey, we not only know if they are going to school or not, we also know how rich they are or how rich their families are. And therefore, we are able to basically rank them. So we're distributing them across the line. And we can do that for primary school age children, those above the line. And we can do the same exercise for secondary school children, so those below the line. And you already notice that those kind of distributions of those who are in and out of school varies depending if you live in poverty or if you're not living in poverty. So we are seeing in our example that one child which is not attending primary school lives below the poverty line. The family lives in poverty. You see that 3 out of the 5 children who are not attending secondary school also live below the poverty line. So that's the allocation of households using the welfare measure. So we're along a continuum. And now we can start calculating actual benefit incidence, and we are linking both informations back together. So we have that kind of distributions, which you see here on our income line from the household survey. And we do have the budget information or the unit costs from the budget information. And we can then fill those kind of information in. So if you focus first on primary school, so remember primary school are those smaller icons above the line, we now can assume that each child which attends school will benefit or has a monetary benefit we can impute, and that is equal to the unit cost in our analysis. So for each child going to school, they're benefiting of, in our case, from $300. Now we can use those informations to calculate how much of the benefit is going towards those living in poverty. And we can calculate that quite easily with the formula you see here. So we're calculating the primary education spending on children below the poverty line. Those are $900 because there are 3 children going to school and each of them benefit from $300. And then we can express it as the ratio of the total primary education spending, which was $2,700, or the sum of all of those kind of unit costs you see here. And you can see that the proportion is 1/3 or 33%. That means 1/3 of the education spending benefits children who are living below the poverty line. So we can do the same exercise for secondary school. So you can see now below the poverty line, only one child below the line. You can see only one child below the poverty line goes to secondary school. So they're benefiting from the expenditures on secondary school, so $500. And the other 4 are living above the poverty line. And again, we can calculate the secondary education spending on children below the poverty line. This is only $500 out of the total secondary education spending. And you see this proportion is 20%. So there are two things we can take away from this kind of analysis. One, education spending is more regressive in secondary school than in primary school. That's an observation we often have in those kind of analysis. Because secondary schools are usually less attended by children who tend to be more poor. And the second finding is that education spending in this example is not pro-poor in either education level, so neither in primary nor in secondary. And you can see that when you compare those 2 proportions to the rate of children living in poverty. So you see out of those 10 children, 4 are living in poverty. So the poverty rate is 40%. But you see that those 40% of children capturing 33% of primary education spending and even less of secondary education spending. So they're capturing less than their proportion of the population. And we would therefore characterize that as not pro-poor. And that links very closely to the indicator. And Enrique will talk more about that in a second. So before I hand over, I just want to finish that example up with one more complication. And that was the one I mentioned earlier, where we often probably have situations where we have different unit costs for different kind of children. So let's assume for a second we are just focusing on primary education, And let's assume those who are living below poverty lines, those 3 children who are going to school, they're also going to school in areas where, which are generally poorer areas of the country, but maybe quite rural areas where education spending is overall lower than in more urban areas or more affluent areas. And it wouldn't be unreasonable to have a distribution as follows, where the unit costs for those living below the poverty line are lower than the unit costs for those above the poverty line. And obviously, there could be much more complex variations of unit costs. But the idea being now that if we try to create this, calculate the same ratio, that the spending benefiting those living below the poverty line is now even lower compared to our previous example, as those who are going to school are going to schools which are receiving basically less benefit. Again, that example just reiterating the importance of, like, there is an easy step we can take by using uniform unit costs, but there are obviously much more sophisticated ways to improve those kind of analysis. If we have more information available, we can use for that. So I leave it here with a quick, hopefully not too quick, but not too long either, introduction into the benefit incidence analysis, and hand over to you, Enrique, for the technical part.
Thank you, Oliver. Let's see if we can shift quickly to my screen, which I will try to share. It should be working or not. Can you see my screen?
Yes.
Excellent, very good. So as Alexander said at the beginning, this is SDG 1B1 that we're talking about, which tries to answer the basic question, who's benefiting from public social spending? Is part of the overall framework, is part of goal 1, in particular when we try to measure sound policy frameworks at the national level. That's what it's about. So that's why we look at proper public social spending. Let's see, at some point my screen should move. Aha, yes, very good. So we're looking at the proportion of government spending in health, in education, and in social transfers, all 3 of them, that benefit the poor. And the way we do that, the way we estimate it, is the way Oliver was just describing. We look at all the health expenditure, we look at all the education expenditure, and we look at the direct transfers, which are cash transfers, or even if they are near cash transfers or quasi-cash. And we use, or we have been using so far for the reporting, national poverty lines. And the reason we're using national poverty lines is that what is important here is if the expenditures the government is engaging in helps the people in the country, and the people that are poor as defined in the country, not by measures which may be used to compare across countries, but might not estimate properly the poor in the country, could over or underestimate. So what do the data tell us so far? And I just want to be clear, I'm going to show you 2 different types of data. The data as reported officially in the SDG database, but also additional evidence that we have, which is answering the same question. So what do we have in the global SDG database? This, just 11 countries. And although 11 is a good number, it's what you need to have a football team. In terms of international reporting, it's not that good. This is the latest update as of December 2023. For the record, is the first time that there was recording of this data. As of 2022, we didn't have any official reporting. But now we do. And I think that is a great piece of news. I think this is a major achievement. Now, why do we have the data gaps? There are a couple of reasons why we have these data gaps. If you followed what Oliver was saying, we need information on public spending, we need which is from the budget, We need to be able to disaggregate that by sectors and subsectors. We need to have the household level information of the people in Oliver's example, children going to school, but the same, about health and households and families and individuals receiving social transfers. We need that from household surveys, and the household survey has to allow to rank, as Oliver was describing, those that benefit or do not benefit from these surveys. And of course, we want to compare all of this and put it together. All of that becomes a bit difficult. Not every country has information on that. But then the final results tend to have a lot of political reverberations. So a lot of countries have the information, but they are a little bit careful about presenting it. And this is one thing that we think it's very, very important to keep in mind. The important thing is for countries to know what's going on. It's not just about reporting. Yes, of course, reporting is very, very important, and we need that. But countries are not supposed to be measuring this in order to report. They are supposed to be measuring this in order to be able to improve the efficiency of their budgets. And I'm going to come back to that in a couple of minutes. How do we interpret? How do we interpret the final result? Because the final result, as following, for example, in what Oliver mentioned, primary education, the children are receiving among the poor families are receiving 33% of the public spending, and that's what children are benefiting. Is this good? Is this bad? Is this a lot? Is this very little? So we need to put this indicator as the G1B1, the share of public social spending that accrues to the poor, in the context of how many people are poor. Look at this example. The red bars are people in monetary poverty, percent of the population. The yellow bar is public social spending on the poor as a percent of the budgets. Always these bars are percentages. Look at country one and compare with country two. In country one, the share of public social spending going to the poor is 30%. In country two is, quote unquote, only 20%. However, in country one, the big, tall, red column that comes first, the 60%, the ratio of what the government is spending compared to the amount of, or the percentage of people that are poor is very little. But if you look at country two, where, quote unquote, only 20% of the budget is going to the poor, but we notice that the poor in the country are 10% of the population, then that ratio now is 2 to 1. Well, in the other case, was only 0.5, meaning half. So this is how we interpret whether the expenditure is progressive or regressive. In the second case, this is regressive because the poor are receiving from the government, in terms of quantified services, health, education, social transfers, more than the share of the poor. In the first case, country one, the poor are receiving less than the fair share. They're even receiving less than their proportion of the population. But these are simple hypothetical examples to make the case. This is what happens in the real world. These countries having this now, notice that this is more than 11 countries. We have 30 countries here. We have information which is comparable across the three sectors: social transfers, education, and health, and we have a comparable measure of poverty based on national poverty lines, and we can calculate the ratio. And you see there are many countries in green, meaning what the government is spending on the poor as a proportion of the budget is more than the proportion of the poor in the country. Unfortunately, there are also several countries in red, and sometimes in ever dark red, which means what the government is spending on the poor is less than the proportion of the poor in the country, and thus they are regressive expenditures. And there are about 30 countries here. Now, when we want to analyze the impact of this, the impact on the actual living conditions of individuals, we are tempted to do further analysis. We are tempted to look at public health expenditure, which you see on the horizontal line, and the percentage of population covered with public hospitals or clinics, for example. And that black line is the goal, right? 100% should be covered. That's what the SDG says. Everybody should be covered in terms of access to health services. But if we were to do a simple regression analysis trying to correlate public health expenditure and access to public hospitals, a line would not do. A line could result in estimates where public health expenditure indicate or predict that access to health services will be more than 100%. That's the red dotted line. That cannot be. We need to use a nonlinear regression, a logistic or a probit or something, but we also have to be cognizant that the impact depends on many other intervening factors. It's not just how much we are spending. And that's where the equity come in. And that's the equity we're trying to analyze with SDG 1B1. It's not just how much we spend, but also how is that spent and who's benefiting from that spending. These are data. And notice that every time I show you examples of data that exist, I'm adding the number of countries. First, we started with what's officially reported, 11. We have data based on monetary poverty, national poverty lines, which we can compare across countries for about 30 countries. Now we have more because we're looking at ranking. If you remember those slides by Oliver, where we have to rank the welfare conditions of the children that were or were not going to school, is here, instead of ranking them by income or consumption, we rank them on an index of asset wealth, and a wealth index. And now we have even more countries. And this is just for education. It's not for all of them. Now, the names of the countries and the numbers come a little bit small, so that's why we blew up this part. There are countries where the percentage of public spending that goes to the poorest 20% of the households, the poorest quintile, is less than 10%. This is a really inequitable spending. And it happens in high-income countries, in upper-middle countries, in lower-middle-income countries, in low-income countries. The richest 20% always get more than the bottom 20% across countries. This is not a law of gravity. We can change this, but as of now, this is what's happening. And not only is expenditure inequitable across countries, but it's more inequitable on average in the poorer countries than in the richer countries, which means the poorest children in the poorest countries are the ones receiving the least benefits from their governments in terms of supporting, in this example, public education. Now, there are times when the pattern that we observe in terms of the equity of public spending in primary education doesn't quite follow what I was just showing you. If you look at the red columns here, we have the poorest, the second poorest, middle, almost richest, and the richest quintiles. And the expenditure or the proportion of public spending that goes to the middle quintile is where this peaks. So the bulk of the expenditures goes to so-called middle class, and it's the richest and the poorest that are not benefiting as much. That seems not that good, but then we have the yellow bars, and in the yellow bars we see a very progressive expenditure pattern, because the poorest 20% are getting 25% of the expenditure. I hope you can see the little numbers on the vertical axis. The richest 20% of the children are getting less than 20% of the budget. So this is progressive. This is good, except that these, by the way, are subnational data in provinces within a country, except that the quality of public spending, the quality of public spending in education, the quality of that education is lousy. So anybody that can save a little bit of income would flee the public education system, and they will try to go even to low quality privately provided schools. So what looks like a progressive expenditure pattern, it's actually a reflection of poor quality education or different attitudes by parents that perceive the public education as not that good and would then spend money, even as I said, on not even good quality private education. So we always have to be very careful how we interpret these numbers. But we know that equitable spending, again, continuing with the education example, this is enrollment in pre-primary education. The more equitable the spending, the more likely more children are going to be in primary school. This happens in high-income countries, which are the yellow ones, middle-income countries, and the low-income countries, which are the red dots. It's very similar when we look at primary. The other one is pre-primary. This is primary. But here we're still looking at the equity of spending and the results. In this example, which looks at health, and it's also based on real data, but with a few less countries, what we have here is the combination of the total expenditure as a proportion of GDP in health, proportion of education, health expenditure as a proportion of GDP, and how equitable it is. That's what we have on the floor of this graph. This is a three-dimensional floor, three-dimensional graph. I hope it's clear. Bear with me just a minute or two so that we understand it together properly. In the front we have ranked the countries from inequitable spending, somewhat equitable, to very equitable spending. How do we do that? With the methodology that Oliver mentioned earlier. Then we have on the side, but also looking horizontally, expenditures which are low, sort of at the back of the graph, medium expenditure, and high level of expenditure. How do we measure this? As the proportion of health expenditure out of GDP. What do the bars show? The bars show under 5 mortality. Now, under 5 mortality is a bad thing. The higher the under 5 mortality, the worse the situation is. And you can see those in the red bars. The green bars have lower under 5 mortality, which is a good thing. And yellow are somewhat in the middle. But look at the distribution. The bad outcomes, the high under 5 mortality, those are tending towards the back corner. Low expenditure and inequitable expenditure. Where are the green bars? Where are the countries where under 5 mortality is lower? In the front corner to the right. Which are those countries? The countries that spend considerably and they spend equitably. We have done similar exercise. This is just for a subset of African countries for which we had the data. And on the horizontal axis, we have government spending on health as a percent of the government budget, in this case, not of GDP as before. And in the vertical, we have under 5 mortality. So we associate total spending with under 5 mortality, and we see a downward trend. The more that we see these countries spending, the better the result is in terms of under 5 mortality. Then we did the dotted lines. The dotted lines are sort of in the average of the under 5 mortality rate for these countries and the average of spending for these countries. And what do we see when we do this classification? Among the countries that spend little and under 5 mortality is high, we have only sort of 3 countries, but 2 of the 3 are pro-rich, which means they are regressive in the equity of their spending. When we look at the countries in the opposite corner, the countries where they are spending quite a bit and they are getting good results, a lot of those countries have like the little plus sign in front. And if you look at the legend explaining what it is, that means they are pro-poor spending countries. So not only they are spending what is required, but they're spending it equitably, and that leads to better results. I hope I'm okay with time. Yes, we have time for question and answers. This is the end of the presentation Oliver and I had for you today. Thank you very much for your attention.
Thanks so much, Enrique. Thank you, Oliver, for this great presentation. I would like now to open the floor for questions to our speakers. I will try while to allow the microphones and also the cameras, so we can have a more interactive atmosphere. So I switched on those now. So if you would like to ask a question to Oliver and Enrique, please raise your hand and let us know that you have a question. If you don't want to speak or you cannot speak right now, you can also type the question into the meeting chat. That's also a possibility. And maybe while we until somebody raises the question, I would have maybe a question to start off. So you're always referring in your analysis to public spending, and you touched upon the area of my question a little bit earlier, but maybe you can go into a little bit more detail there. Especially in poorer countries, people often send their children to private schools when they can afford it. So this is then, if I understand you correctly, not included in the analysis. Or is it? If it is included, maybe you can explain a little bit how this is done. I think that would be quite interesting, how that influences also the outcome for the children. Thank you.
Oliver, you want to go first, or should I go?
Go ahead, and I can add something.
Yeah, sure. No, the SDG indicator, which is intending to measure good policies to address poverty because it's under goal 1, only looks at the public spending. So the benefit analysis in terms of the public spending. This could and should be complemented with an analysis of the private cost burden on the families. And there are plenty of analysis both in the health sector and in the education sector of how much are families contributing to these benefits. And what we have observed there, or what has been observed in the literature, is obviously richer families pay more for their own health or the education of their children. But the burden could be less. So the burden for a rich family, even if they spend 2, 3, 4 times what a poor family spends on the education of their children, could be a small proportion of their total resources or monthly budget or whichever we counted. While for the poor, it could be like a really huge sacrifice. And they may be paying a fraction of what the rich are paying, but they may be putting a third or a half of their monthly budget to their children's education. But that is not included in this indicator. If as I have the floor, if I may, because there was a question on the chat that I have seen on subnational. When the data are available, we look at all the public funding, federal and state, and of course we only have 11 countries reporting, right? But ideally, the countries should be reporting on the disaggregation of that per the disaggregation guidelines of the SDG framework. Let me stop here. Oliver, maybe I missed something, or you want to expand? I will also look at if there are any other questions.
Yeah, just to maybe add on the private services versus public spending, because we saw that in a couple of, so we as you noticed probably from the presentation, at the moment, the indicator looks at the total population, right? But we do additional work, and we would encourage, obviously, also countries to disaggregate the data, as Enrique was saying, subnationally, but also by gender, by age, by other kind of key demographics, which is possible, but it might be a second step. But we did a few analyses specifically focused on children in Kenya and Indonesia and a couple of other countries. And we actually noticed exactly that picture, Alexander, you mentioned, that especially for primary school, you have a lot of children from richer households going to private schools, which actually means the spending for primary school often is more pro-poor, because the remaining spending concentrates a bit more on poorer households. And then if you have less children going to private education, that kind of picture moves. So it does impact our analysis as well. But yes, Enrique was explaining, it's not directly part of the measurement.
Thank you.
Thank you. Sorry, Alexander, just to complete the answer, because I hadn't properly read the question on the subnational. How does the result? How are the results impacted? One of the slides that I showed that had red and yellow bars, it shows that in some cases a province could have a more egalitarian spending than another province. So that, and that we have seen in practice empirically. So it does affect the results when we look subnationally. Go ahead, Alexander.
Thank you. Yeah, so we have two hands showing. So I will first go to Habib. Habib, if you want to unmute yourself and maybe put the camera on if you can, and ask your question. Thank you. Or if you cannot speak right now, Daniel, you want to go first, maybe?
Sure, Alex. Thank you. Thank you for that. That's an excellent presentation going through the 1B1. So we're excited to see more work is being done there. I'm from the SDG monitoring unit in the UNSD, where we support IAG SDGs. One quick question I have, as you know, the 2025 comprehensive review is going to happen this year. And one of the key questions being asked is the data gap issue. So if you have your indicator in the framework, the availability is expected to a certain level. And as you see, 1B1 is very low in terms of coverage being reported. What is your expectation in terms of ramping up the number from 11? I see that you've been working on 30 countries. We're expecting 30 would be there, but I think that's even lower, right? So we have 193 member states who needs reporting on this. So is there any kind of work from your side in terms of approaching countries? Probably the reservation could be because they are not, very intuitive to the methodology which is being applied. So is there something that UNICEF is doing, pushing countries, do an in-country work in showcasing the methodology, working with the National Statistical Office and things like that? Just wanted to know if there is a plan in that regard. Thank you very much.
I can start that. Yeah, so we do have, we have absolutely planned a lot of different ones. So events like this and many other opportunities, we do try to generally raise awareness of the indicator, try to link countries who are interested with resources, and potentially we can actually think about some country-to-country learning, because there are some really good examples, like the UK, for example, is now measuring the 1B1 on its own based on the metadata. So the line you saw in there in the global database is actually based on country-specific measurement and reporting. So yeah, that's certainly part of it, and we do hope that this work helps to increase coverage, and we do encourage internally within UNICEF and within Save the Children for colleagues to be aware of that, and to increase increase countries and NSO's awareness for this indicator and this issue. We also and we didn't want to make it too complicated, so we left it out of the presentation. But we are thinking at the moment of extending 1B1 to, as we're saying, national poverty lines make a lot of sense, and they're the ones which are really relevant for countries. So we're really happy with how it is defined. We do think that is the most suitable definition for countries. We are thinking about adding the poorest quintile as a second alternative. So where the money being benefiting the poorest 20% in each country. If we have that definition, we do have much more comparable data for many, many more countries, because there are global assessments done by the World Bank, by individual research institutions and others, by some of what UNICEF did in the past, what Enrique was showing on the education one. So it does offer a much broader reporting basis. So we are hoping that this kind of two-track would help to keep the indicator really relevant for countries to measure, but also offer a way how we can increase coverage quite significantly. So we're putting at the moment that together and preparing the metadata, and we will submit that for the comprehensive review next month. But yeah, great question. Thanks, Daniel. Enrique, sorry.
Sure. No, I just wanted to add something that you mentioned, Oliver, in your presentation. This is not a new thing. This has been known as a methodology for at least 50 years. So, and it's not a terribly complicated thing. It's a little bit of accounting and adding some things and dividing others. It's not an extremely complicated thing. The two difficulties that we have encountered in the last few years in reporting this with countries is a little bit the ball dropping between the statistical office and the finance ministry. Because unlike other indicators that you can extract directly from a household survey or the census, you need to combine the different sources of data. And as this was a new indicator that was adopted in March of 2020, and I don't know if everybody remembers what happened in March 2020. Maybe you would rather forget what happened in March 2020. It was a bit uphill to get countries engaged in a dialogue about reporting this when the pandemic was going on. So it suffered a little bit from that element. And the second thing is, even when we have the numbers, and we have been in dialogue with governments, they say, well, but we don't want to report that number. Because you saw the map. There are a lot of red countries which show, or the data show, that the countries are not putting enough money into their poor population. And sometimes countries don't want to say that publicly. And that is a little bit of a challenge. It's not a technical challenge. It's not a data availability challenge, but it's a really difficult one. But we are trying, and we have tried to look for funding to help countries, etc. So
thank you. I would like to go back now to Habib. Habib, if you can unmute yourself. Yeah, please go ahead.
Yes, thank you, Alex. I could not unmute myself before, so I changed to my laptop. Sorry about that. Thank you for this presentation. This is very excellent work. I have a couple of questions, really. So I know that some experts advocate for an universal approach in public spending, right? So my first question would be, if a country chooses a universal approach, could it lead to unequal allocation? So could this be the case that the richest part of the population are more well positioned to access those resources, and that leads to an unequal, as you use, regressive allocation of resources? So that's one question. Second question is that the charts you showed, really interesting, and from I guess from a statistician's perspective, so we are always trying to, when we put things side by side, we try to put them on an equal basis, right? So could this be possible that, for example, you showed example of two countries, right? So in one country, the proportion of poor was very high, but the allocation of resources in education as a percentage of total public expenditure, right? That's what, okay, was low compared to another country. But could this be the case that some country spends a lot in public spending to begin with? So although it's not equal, it's regressive, right? But the per capita allocation to the poor could be higher than some other country, which would be progressive in its allocation. So these are the two. I actually have three questions. I'll just go with it. So I saw that I was looking at the indicator of education expenditure as percentage of GDP, right? And if you do like a simple ranking of that indicator, there are some really interesting country at the lower end, right? So countries which are known to do well in education. For example, if you look at the South Asia region, Sri Lanka is perceived to be doing well, but their expenditure as percentage of GDP is pretty low. It's one of the lowest in the world, right? So how do I interpret this situation? Thank you. Sorry for so many questions.
I should have written them. I don't know if I remember all of them. Oliver, you want to go first, or should I try? I will try to answer the two questions on the side.
I can very quickly go on the universal side, and then I leave the more tricky questions to you, Enrique. I mean, the universal one is tricky as well. They're all really good questions. Yeah, so on the universal side, yes, so there will absolutely be correlations between that, right? Like, but I think we even so both Save the Children and UNICEF are very much supporting and calling for universal approaches when it comes to child rights in, for example, social protection or many other fields. But this does not necessarily mean that this would translate one-to-one to an equal spending across all groups, right? Like, so if you remember the example I shared earlier, there are basically two things which are driving the poorness of spending. One is the utilization of services. So if poorer children are not in school, they can't benefit from education spending. That in itself would be an issue, right? Like, even if we are having completely universal equal spending on every student in school, it is still unequal. It is still unfair that there are some children, likely from poorer households, who are not going to school in the first place. So that is a problem in itself, even if spending would be completely equal. The second bit is then example I mentioned with the unit costs, where allocations to different children within school might be different. And again, if we are seeing that children from poorer households who have likely to overcome more barriers to attend school in the first place, who are known to have lower test scores, often because they have more difficult or more challenging backgrounds, they very likely require more investments. So you would actually, if you do see different unit costs, you would hope you see the opposite picture from the example I was showing, and you see actually higher unit costs for children in poorer households and slightly lower unit costs for children in richer households because they have a more beneficial environment to begin with. So I think universal systems do not necessarily imply universal spending exactly across the distribution, but it's a really good question, and it will certainly have implications how we track that. So I hope that was the easier question, Enrique. I'll leave the other two.
Sure. A couple of things very quickly. It's what you just described, Oliver, which I think and I hope answers the question, is the difference between equality and equity, right? And it's something that we always have to keep in mind. And for the other question that you asked, the example, is it possible that for whatever reasons, maybe private spending by the parents, we see a situation where the government is spending more on the poorer children or the poorer families? Yes, it does. It's possible theoretically, and it happens in practice. We have seen it in some cases. Most of the time is a good thing because it means it's a progressive allocation and the government is putting more effort into the poorest families. But sometimes, like the example we showed, it's an indicator that something else is not going well, which could be the quality or could be the perceived better quality of private providers. So I hope that answers the questions. If not, please ask again if there is some nuance or detail that we have missed. I would like just to say, I know we are over time, so I want to say just 3 words on a couple of questions which were on the side. What about the subsidies that governments give to private or religious education? But it's still public spending. So how do we count it? With a lot of difficulty. There are 2 things that we need to have for that, and we usually do not have. A, the proper disaggregation within the budget of the education budget that is used to support those private or privately provided schools. But also in the survey, we need to know what type of school the child is going to. Now, some of the surveys do provide that information, but not all of them. So it's a very, very important issue to get the complete picture, but usually very hard to capture. Yes, COFOG is exactly what should be used. And when we have been trying so far to get countries to report themselves with their own budgets, but when we try to do the analysis and then say to a country, look, this is what your situation looks like, then we can certainly use COFOG the way you suggest. I think that's a very good point. Then, yes, the data gaps. Yeah, there is one more question, but yeah, Oliver.
Yeah, just before we forget it, just to remind also everyone, in the invite, there was a link, and I put it here again, to a resource we published together last year, which gives a quick overview. Like, there will be some bits you are familiar from the presentation now, a quick overview of the indicator, of the existing data bits. There's also a small box on what the UK has done. They're also linked to resources, like there are institutes which have focused on improving the methodology. They're providing a lot of training material for countries to really apply that in their own contexts. So please do have a look in that resource. It's only a short, like 5-page or something like that, a short brief, but it has more links to existing tools and other methodologies. So I just thought I mentioned that because that might be useful for some of you on the call.
Yeah, thank you, Enrique and Oliver. You've seen there are a lot of questions and probably many more. So I would encourage everyone, if you still have questions, please reach out to Enrique and Oliver, or ask the question also on the global network. Before you all go and head on to the next meeting or whatever, maybe I can encourage you to switch on your cameras and unmute yourself, and then we give the 2 a big round of applause if that is possible. So please join me and give them a big round of applause. Thank you.
Thank you very much.
Thank you very much for having us.
Thanks, everyone. And please join us for our next Global Network webinar in 2 weeks. You will receive an invitation for that shortly. Thank you. Have a good one. Bye-bye.
Bye.
Thanks, everyone. Bye.